Sharma, who is a renowned surgeon around the world, has over 40 years of experience in the field of urology, and who headed the Department of Urology in one of the most premier medical institutes in India, that is Postgraduate Institute of Medical Sciences and Research, Chandigarh. So what are the treatment modalities of carcinoma of the prostate?
The best treatment for early carcinoma, that means well differentiated, Gleason score 2 to 4, it is the radical prostatectomy. Radical prostatectomy means we remove the whole of prostate, seminal vesicles, and then join the urethra back to the bladder. This gives the best prognosis. And for moderately differentiated carcinoma, that's Gleason score 5 to 6, the best option for him is what's called is the ADT, that's androgen deprivation therapy. That is, because the carcinoma has got direct relationship to male hormone, that's the testosterone. So if you can neutralize the testosterone, this also controls the disease and also brings down the PSA. So you can give them some hormonal treatment, like either you give them anti-androgen like dutasteroid, Fincar, or some injections. So that's a GnRH antagonist or agonist. So they can control the release of pituitary hormones and also release of testosterone from the testes, and thereby preventing the growth of carcinoma prostate. Or the other, if somebody cannot afford, then a surgical orchiectomy can be done. That means you remove both the testes, because testes produces testosterone, and which is responsible for growth of carcinoma. So if you remove the testes, that also provides control of the carcinoma. And in addition, if somebody wants, this can also be removed by radical prostatectomy. But if the carcinoma is advanced, that means it has gone outside the prostate into the lymph nodes or into the bones or liver or distant metastasis, then the treatment is different. In such situations, people are usually elderly, and many surgeons may not consider them for radical prostatectomy. They are only treated by ADT, that's androgen deprivation therapy, and some hormonal injections, like leuprolide, injection leuprolide, that provides, the injection is given once in 3 months, and the patient is followed every 3 months with PSA estimations. With this hormonal manipulation, the PSA levels come down and the growth is also prevented. It regresses, the symptoms improve. And the only thing is, with hormone manipulations and in advanced carcinoma of the prostate, the good effects of the hormonal manipulation continue only for 24 to 36 months. After that, again, the relapse occurs. Then it has to look for different type of treatment like chemotherapy, radiation therapy, and things like that.
So doctor, what is the percentage of people who are completely cured following treatment with these modalities?
The patients with early disease, with the histological diagnosis of well differentiated carcinoma and PSA levels below 10 nanograms or 20 nanograms, they do much better. I think the 5-year survival or 15-year survival in them is very good.